I'm going to, I was briefly a high school teacher, and so when you do that, you learn a few tricks, like getting up and moving around enables you to better make eye contact with individuals who may be nodding off or otherwise, not fully with the program. So I'm going to be roving. Be ready. That's all I'm saying. So it's really a pleasure to be here today. In terms of the day of the week, let me just say Saturday is the new Monday. And then I've been to a number of these conferences through the years, always in Buckystown until this one, and I do somewhat miss the pastoral landscape of Buckystown. It actually, though, turned out lucky for me that we were here this year because I had a flat tire when I intended to be here a little earlier than I ended up getting here because I had a flat tire when I left today. But one positive that came out of it was I got to hear, as I was driving, an episode of This American Life on NPR, which is always a good thing. But this particular one was a story about a group of Christians who got together to try to win a lot of money gambling. And they ended up making between $3 and $4 million by learning to count cards and playing blackjack in the casinos of Las Vegas. It's an option. That's all I'm saying. Something to think about as we look to the future. So now you also know why I like to have my own microphone so I can do my stand-up. So listen, let me first give you a little orientation on PEPFAR. I feel like many in this room know PEPFAR very well. Like, for example, that it stands for President's Emergency Plan for AIDS Relief. We get that all the time. We recently had a meeting with a member of Congress who ended up really fixating on the acronym and each word of the acronym and everything. So I think with this group, public health professionals, we're just going to assume you get the acronym. And move on to a little bit of what the program is. So it's the U.S. government effort to fight HIV/AIDS around the world. It embraces everything that the U.S. Government spends on HIV/AIDS. And it's kind of unique in that it's an interagency initiative. From a bureaucratic standpoint, it's led by the Department of State, so OGAC, Office of the Global AIDS Coordinator, is the office at the State Department that leads it, and that's where I work. But we include all the different U.S. agencies for their work on global HIV/AIDS. So USAID is our largest implementer, and CDC is next. I bear regrets from Sandy Thurman of CDC, who planned to be with us here today and couldn't quite swing the trip up from Atlanta. But it's really, and then the Department of Defense is our next implementer, Peace Corps, and then a few others. And I'm sure you're familiar enough with the U.S. government to know that the Department of Defense and Peace Corps are two very different operations, even if you're not that familiar with USAID or CDC. So clearly, we have a lot of different elements of this thing, and when the Bush administration and then Congress decided to create a unified HIV/AIDS initiative focused on this one disease, they created this kind of virtual organization that embraces the strengths of all these different organizations. It's a lot of work to make it all work because they are so different, but each of them really bring some things that we wouldn't have if we had the individual agencies doing their own slice. So at the country level, our U.S. ambassador is the head of PEPFAR, as he is of all global health and development, other activities in a country. But part of his or her job is to pull together the different agencies that are working in Kenya or Vietnam or whatever the country is and get them to work as a coherent whole. So that's a bit about PEPFAR. The picture on global AIDS, which is a subset of the picture Ariel offered of global health overall, is also a very positive, encouraging one at this moment in history. Over the last decade, we've seen globally almost 7 million people go on antiretroviral treatment. And AIDS is kind of a unique disease in that there is a one-to-one correspondence between getting the treatment and not dying, because it's still a completely fatal, completely incurable disease. So compared to some, it has a relatively clear metric of success. So we know that those people, the vast majority of whom are in Africa, would not be with us anymore if not for the treatment that they are being provided, mostly by the United States, but by other donors as well. So really a striking change from a year ago, where in Africa an HIV diagnosis was basically a death sentence. I don't think it's an overstatement to say that. And now it is increasingly a manageable chronic disease, as many of you know because you're involved in managing it, either there on the ground in the developing world or here from the headquarters of an organization. In terms of new HIV infections, again, as Ariel pointed out, a dramatic decrease. He showed you South Asia, but in Africa, it's been an over 25% decline in new infections over the last decade. There are only a few countries that have not seen a sharp decrease in new infections. There are many elements to that story, and we'll never be able to probably explain what intervention contributed how much of that decrease. Clearly, treatment has been a big driver of it. Now that we know that people on antiretroviral treatment are essentially non-infective, virtually non-infective, we know that putting so many millions of people on treatment is clearly one of the things that's reduced the new infections. But the programs that have focused on behavior have clearly played a part. Other biomedical interventions, male circumcision, is being dramatically scaled up and is clearly having an effect. So it's a large, complicated story, but part of it certainly is the role of faith-based organizations. Again, Africa, by far the world's hardest hit region, with about 2/3 of the people living with HIV, but also an area with tremendous health assets in the faith sector. And nobody can seem to agree on what the exact percentage is, but still, it's a huge number in most of the countries in Africa of healthcare that is provided through the faith sector. So as we look back at this past decade, I think it's fair to describe it as a dramatic turnaround, a real transformation of the global HIV/AIDS picture, with the faith sector playing an important part of that story. From my perspective, both the overall story and the role of faith-based organizations are somewhat untold stories. I think both of those elements would be surprising to most people. I certainly find, very few people, even people who are fairly sophisticated, are aware of this dramatic transformation on AIDS in the last decade. It's partly my fault because that's part of my job is to get the word out about what's happening. So sorry, but it's partly your job too. So let's talk about that. Now, that's where we are now. I would like to talk a little bit about where we go from here. And it's on the front of my mind, this question, because we just held a consultation with faith-based organizations from 4 East African countries in Nairobi 2 weeks ago. Our PEPFAR office at State and CDC, and then the Emory University got together to put on this conference. And it had a couple of different elements, but there's one in particular I will emphasize when we get to it in a moment. But anyway, it was exciting to be around people from the faith sector who were working on AIDS in that region. I do have to point out, it wasn't just from the Christian community. There was vibrant, I guess personally more vibrant than I expected, Muslim presence there. That there are these Asian nations, at least in East Africa, have Muslim councils focusing on HIV/AIDS and doing great work. So that's an important part of the picture of faith-based organizations. And of course, there are other faiths beyond just those two that are involved in one way or another. So I'll come back to that, describing that consultation in a moment. But in terms of where we go from here, my comments are going to be a little bit perhaps in the practical or not very lofty or inspiring, but more just kind of concrete and I hope in some way helpful. And I want to use a prop to start this, and it's that stool that one might notice, 3-legged stool. And so I want to use the image of the 3-legged stool to talk about where we, the world, go from here on HIV/AIDS. And so for my purpose today, The three legs represent bilateral efforts on HIV/AIDS, of which the PEPFAR program by the U.S. government is the largest example. What we mean bilateral is just one country doing it. The second is multilateral efforts, in which many countries come together, and the Global Fund to fight AIDS, TB, and malaria is the leading one of those. And then the third are the resources within the country, the affected country. You know, Cote d'Ivoire, Ethiopia, whichever country it is. Now, it's not a perfect image because one piece that doesn't fit that neatly into this classification are the investments made through, say, private donations. So many of you are with organizations that are funded by philanthropy here in the United States. And one could argue that we should expand this bilateral leg to include that or whatever. Let's just put that out of our minds for a sec and just focus on these three elements, because I want to talk a little bit about the involvement of the faith community in each of those three pieces. So let me start with PEPFAR. Faith-based organizations are essential to PEPFAR in many ways, but two of them that I would highlight. First of all, as implementers. I know many of you who've been working or whose organizations have worked in the HIV/AIDS field certainly, are aware of the huge influx of resources from the United States through PEPFAR over the last decade, and many of your organizations have benefited from it, or I shouldn't say benefit really, but use them to benefit the people you serve. So just as the role of FBOs as implementers is critical. But I would also highlight the role of FBOs as advocates here in the United States. Shellie touched on this briefly. We really do depend for the resources we get on PEPFAR, for PEPFAR, on the advocacy that you all do. We have been really incredibly blessed with strong bipartisan support from the inception of the program 9 years ago to today, and it's still continuing. We really did a lot better than we expected in the first round of the 2013 budget discussions up on Capitol Hill. I'm not sure that's on people's radar yet, but Congress essentially held us flat from, again, it was the beginning of the appropriations process. There's more steps, but at least out of the starting gate, they held us flat from 2012. In 2012, they held us more or less flat from 2011. 2011, more or less flat from 2010, in an environment where many others were heading south. So that is directly attributable to the advocacy that goes on, to the ability of people like you all especially to share with your members of Congress on days like, I don't know, Monday, the value that you see in this work that we're doing. I don't know if is anyone here from South Carolina? All right, I see one or maybe two. Yep. Okay. Oh, good to see you. So South Carolina, Senator Lindsey Graham has really been working on a project to try to build support for foreign aid in the faith community. This is kind of a project he's really has really taken on and has been trying to organize people around for the last month or two, which is absolutely fantastic. So we'd like to, all I can say is thank you for what you've already done and what you will do in terms of letting people know, hey, HIV/AIDS isn't fixed, it's not done, but we do have a tremendous opportunity to get to this endpoint of an AIDS-free generation that Ariel was talking about a minute ago.